So any kind of pus anywhere in the body is a sign of infection. So there is some infection happening, which is why you're having pus from the ear. Our ear is divided into three parts: outer, middle, and inner. So we all know that inside our pinna there is a eardrum. So the part of the ear lying outside the eardrum is called as outer ear, and then the part of the ear lying inside the eardrum is middle ear. So you can have pus drainage from middle ear as well as the external ear. Okay. These are the two most common places from where the pus originates, and the most common infections of the ear are bacterial infections as well as fungal infections. So again, it depends on the source of the pus. Pus originating from the outer ear, may that be because of bacterial or fungal infections, you usually treat it medically only. Surgery is very, very rarely needed. But whenever the pus is originating from the middle ear, that means there is some connection between the middle ear and outer ear, which is how the pus is reaching from the middle ear to the outer ear and hence coming outside. So pus originating in the middle ear usually is usually associated with either a hole in the eardrum or erosion of the bones of the middle ear. Most common scenario. So if it's originating in the middle ear and if you are associating it, if there is associated hole or erosion of the bone, then surgery is important as the final step. So you always treat the pus medically first with antibiotics. And once the pus settles, the ear becomes dry. If you see there is erosion of bone or there is hole in the eardrum, you definitely advise a surgery as the final step. Because if you leave the patient there, then there may be recurrence of infection because of the hole or the erosion of the bone. So if it's a middle ear infection and you just give antibiotics, it's a temporary measure, not a permanent solution. So for such cases, surgery becomes mandatory. Pus anywhere in the body requires medical attention, very simple, because pus is a sign of bacterial infection. And if you never treat the bacterial infection in a shorter time, then it will definitely spread to other areas, which is why it is important to treat any kind of pus coming out of the ear, whether it's from the outer ear or middle ear, but it needs treatment. People coming to me with ear discharge and ask me this question, I have one thing which Indians can definitely do to prevent this. Not really a home remedy, but a very simple thing is never insert cotton swabs in the ear, because they are the number one source of infection, not the treatment for it. People feel ki pus aaya to, let me just clean it, mop it, and a lot of times itching ho raha hai, wax ho raha hai, to let me, just clean it. But in fact, these Q-tips or cotton buds in most cases are the source of these infections, not the treatment. And the other way to prevent ear infections, if they are originating from middle ear, is to prevent cold and cough. So totally not preventable, but whatever diet or food or lifestyle or habits which give you cold and cough should be avoided. And necessary precautions of hand hygiene and wearing a mask if you are prone to recurrent cold and cough should be done.